I'm going to go ahead and get started. I'm going to take questions from people in the room, but just know the main purpose of this talk is a webinar. So there's lots and lots of people sitting at their desks wanting to learn about the Zika virus. The intention of the talk today is to talk to all state agencies and anyone who is interested about Louisiana's preparation for the Zika virus, how we have prepared, how we're preventing, and how we're getting ready to respond. So for the people in the room, I will take your questions at the end of the presentation. For anyone who would like to submit a question on the internet, the address is eocwatch@la.gov. And just know that if we don't get to all of the questions, we will be having a Q&A that will be posted on the internet. This entire presentation today will also be posted for other people who have not been able to watch it today, so they'll have access to that later. So my goals today are to discuss the Zika virus, its risks and threat. I'm going to explore the state's plan for preparation, prevention, and response to the Zika virus threat. I want everyone to understand the escalating response plan if the situation worsens. And what that means is if we identify local transmission, mosquitoes carrying the virus from person to person. And then I want to identify and help people find ways to protect yourself and your family against mosquito bites, which is really what the big prevention is in terms of Zika virus. So the Zika virus is a disease that's spread primarily through the bite of an infected Aedes aegypti or Aedes albopictus mosquitoes, two different kinds of mosquitoes. And hey, we have our mosquito expert here today to correct me if I get anything wrong, and several of our other experts as well. So the virus was first discovered in 1947, with the first human cases detected in 1952. However, in May 2015, the Pan American Health Organization issued an alert regarding the first confirmed Zika virus infection in Brazil. Since then, the epidemic has become much, much worse, not only in Brazil, but in many of the Americas, tropical Caribbean, tropical Americas. And in February 2016, the World Health Organization declared the Zika virus a public health emergency of international concern. So we've got two pictures there. Kyle, correct me. In Louisiana, we have 54 different kinds of mosquitoes? Okay. So I was unaware that there was any different kind of mosquito other than the ones you swat yourselves. But there are
about 65 species. Most parishes have about 55 species, and they all don't feed on humans either.
Okay, so just so you all know, there's lots and lots of different kinds of mosquitoes. The ones that spread Zika virus, though, are these two, most notably the first one, which is called Aedes aegypti. It originated in Africa. This one lives in close proximity to people. And what that sort of means is within 50 to 100 yards of humans. It is found inside your house as well as outside, and it is an exclusive human feeder, meaning these mosquitoes go from person to person. They don't feed on cats or livestock or anything like that. And in Louisiana, this particular mosquito is only found in southeast Louisiana, Orleans Parish, around Lake Pontchartrain, St. Tammany, St. Bernard, Orleans, some of those parishes in southern Louisiana. The second mosquito that I'm going to talk about, Aedes albopictus, that is a potential vector of Zika. In some cases, in other places, it is the vector that spreads Zika. However, they live slightly less close to humans. The origination is Asia. They do not go indoors, and they prefer non-humans, meaning cattle, other things. And so you can imagine in terms of the Zika virus threat, which needs to go from human to human, if this mosquito doesn't like humans all that much and just incidentally bites them, we sort of think of this mosquito, the second one, is less of a threat. However, this one is also found statewide. It's got a much broader range also within the United States. So for the Zika virus in the United States, people serve as the primary vertebrate host. It's interesting to note that the same vectors, Aedes aegypti and albopictus, also spread chikungunya, dengue, yellow fever, and the Zika virus. Before 2015, Zika outbreaks occurred in Africa, Southeast Asia, and the Pacific Islands. In May 2015, the first confirmed Zika virus infection occurred in Brazil. As of January 22nd, local transmission has been identified in Puerto Rico, and they have since gone on to have quite an extensive epidemic. And currently, outbreaks of the Zika virus are occurring in 45 countries and territories. So here's just some statistics about how, since that first confirmed case was located in Brazil, how we have been impacted in the United States and then secondarily Louisiana. So in the United States, we have 1,132 confirmed cases. That means the number of people who have gotten a lab test that showed that they had the Zika virus. Fortunately, there have been no local confirmed cases, and what that means is someone who hasn't traveled to the Americas, someone who hasn't been in contact with Zika virus mosquitoes elsewhere, and got the virus sitting here in the United States from someone else who had the Zika virus. So fortunately, that's zero. We have had one laboratory-acquired case in the United States. Total cases is 1,133, and confirmed there are 14 sexually transmitted cases, and as a result of that, we have identified 5 cases of subsequent Guillain-Barré syndrome. In Louisiana, so far, we've gotten 8 confirmed cases, no local acquired cases, none sexually transmitted, no cases of Guillain-Barré. The Zika virus can be spread through, obviously, the mosquito bites from an infected Aedes aegypti and albopictus mosquito, a pregnant woman to her fetus, sex with an infected man, unprotected sex with a man, and then possibly blood transfusion, organ and tissue transplants, fertility treatment, and breastfeeding. So here's the interesting thing about Zika. The difficult part about it is because it's not so severe, not because it's so severe. And let me explain what I mean by that. The majority of people infected with the Zika virus are totally asymptomatic. They might just wake up one day and think they have a little bit of hay fever, runny nose or something like that, and just go about their day. 4 out of 5 people are not sick enough to go to a doctor or seek treatment for the Zika virus. This means that what they are doing is going about their daily activities. They're going to sporting events, they're going to the grocery store, they're picking up the kids from school, and perhaps going outside and possibly becoming exposed to mosquitoes. The clinical symptoms are usually mild, lasting several days to a week. The most common symptoms in that 1 out of 5 people, fever, a light rash, joint pain, and red eyes. Well, that just described about 10,000 other things as well. Other symptoms can be muscle pain and headache, and just to note, the disease can be severe in some people who are immunocompromised and things like that. However, the main risk of Zika virus is to a pregnant woman who gets the Zika virus during her pregnancy. The Zika virus can cause what we believe to be severe birth defects if a woman gets the Zika virus. Can cause miscarriage, and the main birth defect is microcephaly, which just means small head. The brain and head do not develop normally in a woman, in a fetus, in a pregnant woman. So Zika virus diagnosis, based on a person's recent travel history, symptoms, and test results. It needs to be confirmed by a blood or urine test. Has symptoms similar to other illnesses, like I said, like dengue, chikungunya, that spread through mosquito bites. That's another challenge with this. Just because somebody has traveled to the Americas and comes back with red eyes and hay fever, you don't actually know it's Zika. It could be any one of any number of things, including chikungunya and Zika, and dengue, which coincidentally are also spread by the same mosquito. They may require a doctor or other healthcare provider to order specific tests for several types of infection. Fortunately, in Louisiana, we are able to do those tests. And if anyone has seen our communications to healthcare providers throughout the state, on every single health communication to laboratories, to emergency rooms, to doctors, nurses throughout the state, there is that 1-800 number where a doctor who suspects that someone may have been exposed to the Zika virus, may be ill, calls that 1-800 number and gets guidance on not only epidemiology and the right questions to ask, but also has direct access to testing capability at that point. Unfortunately, there is no medicine or vaccine to combat the Zika virus, so you just have to treat the symptoms. Again, in most people, they're really, really mild. You just tell them to stay in bed for a few days, rest, drink plenty of fluids, don't take aspirin or other non-steroidal anti-inflammatory drugs until dengue can be ruled out. People who take aspirin or non-steroidals and somebody has dengue fever, you could get a complication from that. Most people, we just recommend they take Tylenol to reduce the fever and the pain. But what we really tell people if we think they have Zika during this period to stay home, rest, and take Tylenol is do not go outside and get bit by mosquitoes, is what we really tell them. That's for the protection of other people, their family members, and because we really want to prevent the spread of Zika while they recover. Protection from mosquito bites is key during the first week of illness. When Zika virus can be found in your blood, that's when the mosquito is biting you. The virus can be passed from an infected person to a mosquito through bites. And then the mosquito can then spread the virus to other people. Just know that when that mosquito bites the person with Zika, it usually takes about 5 to 8 days to percolate within the mosquito before that mosquito can then be infectious to other people. Again, to prevent Zika, avoid mosquito bites. Simple as that. The second caveat to that would be avoid unprotected sex with a man who has returned from the Americas and may have been exposed to the Zika virus. Use air conditioning or window and door screens when indoors. Wear long sleeves and pants to cover exposed skin, and then use EPA-approved mosquito repellents with one of the following active ingredients: DEET, picaridin, IO 3535, oil of lemon eucalyptus, paramethane diol when outdoors. And you can find a list of these approved not only on the internet, they're all over now, and in fact we have a program to have that list in all pharmacies in Louisiana as well. So a pharmacist moving forward could be able to help you decide which mosquito repellent would be appropriate to prevent the Zika virus, the particular mosquito that causes the Zika virus. We also have a lot of travel advisories, and I'm sure you all have seen these. All travelers should take steps to avoid mosquito bites to prevent Zika virus infection and other mosquito-borne diseases, especially when traveling to the Americas and in areas where Zika virus outbreaks are occurring. Pregnant women, however, should consider postponing travel to any area where Zika transmission is ongoing. This is a very strong recommendation, not only from the state, the CDC, but most OBGYN, ACOG societies as well. If a pregnant woman can avoid going to an area where Zika virus is going on, please do so. Healthcare providers are encouraged to report Zika virus cases to the Office of Public Health. In fact, the Zika virus and the testing for Zika virus is a reportable disease in Louisiana. And again, there's that 1-800 number that providers are currently using to report suspect Zika virus. Here's just some of our materials. We have a whole wealth of materials out there, and then some of you might have seen these particular ones at airports, ports of ingress and egress. Louisiana has many airports. We have cruise ship terminals. We have people going in and out of the Americas. You must know people who might have gone on a cruise to the Caribbean or Puerto Rico. That's where a very large epidemic is happening. So it's very important for us to educate travelers, not only before they leave on what to do and how to prevent mosquito bites and prevent Zika, but also things to do when they return. So we have partnered with airports, cruise ship terminals, ports of ingress and egress to make sure that we're educating travelers before they leave, during their vacation, and when they return on what to do. And then, of course, when they return, if they do feel like they're having signs and symptoms, even mild hay fever, to report that to a physician and then call the 1-800 number. The physician will call the 800 number and possibly be tested for the virus, or several of the others that are possible as well from the same mosquito. So on April 1st, 2016, the state of Louisiana participated in a national Zika summit. Goals of the summit were to coordinate federal, state, and local response and prevention efforts through a coordinated attack on the mosquito and the spread of the virus, to have Louisiana identify planning and response gaps and provide with guidance and technical assistance for those gaps. In addition to that, on June 24th, the state of Louisiana participated in a far more focused tabletop exercise in Washington, D.C. What this tabletop consisted of is the 8 or 9 states that are known to have that first mosquito in the summer, and to coordinate our efforts and our response and also our communication, not only between states, with our local partners, with our state partners, with our federal partners, to make sure everyone was on the same page in case one of these local transmission cases were to be located.